Hello, today we're discussing chronic constipation and the causes of chronic constipation. Now, chronic constipation can be divided into two main groups. Primary chronic constipation, which is functional and which does not have an underlying anatomical or physiological cause, but which is a result of a malfunction of the wall of the bowel. For instance, there might be a dysfunction of the intestinal motility, or there might be a dysfunction of the visceral sensitivity or the anorectal musculature or the nervous system that exists in the wall of the bowel. Now, chronic constipation is further divided into three groups: normal transit, slow transit, and pelvic floor dysfunction. Normal transit chronic constipation is chronic constipation in which the movement of stool through the intestines is not slowed down in any shape, form, or fashion. It is normal. And patients with this type of chronic constipation usually have psychiatric conditions, underlying psychiatric conditions. Patients with slow transit chronic constipation are patients who suffer from chronic constipation that results from a dysfunction of the musculature of the bowel. So the bowel wall peristalsis, the contractions are not as intense as they should be, so that the movement of stool and the movement of digested material in the bowel does not take place at the normal rate. Patients like this frequently have abdominal discomfort and bloating and infrequent urges to stool. The third group of primary or functional chronic constipation is what is known as dyssynergic defecation or pelvic floor dysfunction. And these patients have difficulty coordinating the contractions and relaxation of the muscles in the abdominal wall and the pelvis. The abdominal wall and the bowel wall contract, and the pelvic floor, which is at the exit of the anus, does not relax, so that these patients are unable to move their bowels in a normal fashion. As far as secondary causes of chronic constipation goes, medications and medical conditions are the two main groups into which these causes can be placed. And medications such as antacids, opioids, non-steroidal anti-inflammatory drugs are common causes of chronic constipation. Less common causes include blood pressure pills, calcium supplements, medications for depression. Medical conditions that can cause chronic constipation include common causes such as a stroke or depression, diabetes mellitus because of the autonomic dysfunction that frequently accompanies diabetes leads to chronic constipation, as does a low thyroid hormone. Low thyroid hormone causes chronic constipation along with the other symptoms of hypothyroidism. Irritable bowel syndrome sometimes presents with constipation in one of its particular types, and disturbances of the microbiome or the microbiota that live in the bowel, the bacteria that live in the bowel, can also cause chronic constipation. Less common causes include dementias, colon cancer, which causes obstruction of the bowel, spinal cord injury because the spinal cord controls the nerves that feed the bowel, high calcium or low potassium and low magnesium are all conditions that can cause chronic constipation. This is a brief overview of the causes of chronic constipation. In the next video, we will discuss the treatment of chronic constipation. Thank you for watching.